as you stated, fluoride's systemic effects are negative. It is now acknowledged by dental researchers and other authorities that fluoride's mechanism is topical, not systemic. In other words, you don't have to drink it for any purported effect on health. How then can the Victorian government claim that it must be forced into the public water supplies? Is this a logical position for public health?
Not particularly, because the topical application of fluoride, being the recognised effective form of treatment, means it absolutely makes no sense to treat somebody systemically with it by swallowing the medicine, because the concentration needed to effectively treat the teeth is reported to be about 1,000 times higher than what is in the water. However, there is this persisting claim by the health authorities that the water in contact with the teeth could be of benefit, but they're not admitting, apparently, that the systemic effect is no longer credible, because obviously that ruins the basis upon which fluoridation of the water is made, that it gets into your system and strengthens the bones and strengthens the teeth, and that's why the treatment has to be put into the water. It recognising that the action is topical and at higher concentration is what you call just taking out the foundations of that hypothesis that was made a long time ago.
So would you say, so we have all these layers to our body, teeth being the hardest, the last place that fluoride would reach, and then you have gradually going back the softer tissues. What would be the first place that fluoride would affect in the body? What organ or part of the body would fluoride affect?
With fluoride exposure, the first symptoms commonly come from just the most common ones that we see, like mouth ulcers from fluoridated water or fluoridated toothpaste. That's what you call the quickest exposure that occurs, because it's basically just, once again, topical reaction on the gums causes the ulceration. But following that, you then get the systemic effects occurring more slowly. One of those things where the effects on the skin, where people get exposed at work to fluoride chemical, and they get itchy, but the itchiness, it will progress from a skin reaction through to a more systemic reaction. I've had one girl who, when she was 5 or 6, she was on fluoride tablets and she became asthmatic. And because I just started to see the asthmatic results from those exposed in the pot room to asthma, with the fluoride exposure, I said, well, it might be good stopping the fluoride tablets. She did, and her asthma stopped. I just met up with her the other day, 20 or so years later, and she'd never had asthma since, until the water was fluoridated. But first off, it started with an itchy skin rash, and that persisted for a few months, and then she developed asthma again, just like she had on the fluoride tablets as a youngster. Now, with the same fluoride therapy through the drinking water, she was now returning back to asthma. But what was interesting was her young son was getting the same reaction, itchy skin rash to begin with, and as the itchy skin rash subsided a little to some degree, that's where the more chronic form of systemic effects, where you get the bronchoconstriction and the asthma develops, and the skin rash gets less. It's still there, but it's less. And Dr. Hans Muhlenberg has written about this, pointing out that often that initial acute reaction is the forerunner. As the acute reaction gets less irritating, more chronic symptoms develop. And this may be one of the links with, say, joint disease, arthritis, and these are the symptoms which are identical to what the workers exposed to fluoride in the workplace. The warnings go out in the hazardous chemicals warning sheets about these problems. This is where the acute reactions that people are reporting, they may not be permanent, they may or may not, sometimes they ease off, but often it'll transform into a deeper health problem. And if it's not picked up by a doctor at the initial stages, where we just give you cortisone for your skin rash, dear, then as the skin rash might eventually ease, then they're equally unlikely to be picking up the muscle or joint disease symptoms which are developing as also linked up with the fluoride. So that's why it's critical for proper testing to be a system of proper testing of metabolic action of fluoride on people, as the NHMRC recommended in 1991 be carried out, because without that then it's going to be still guesswork. Even though the guesswork is getting people better as they get off the fluoride, we still don't know for sure whether we can see a biochemical confirmation that it's the fluoride causing the health problems.
Can dental fluorosis be dismissed as just a cosmetic effect? Dr. Andrew Harms, former president of the Australian Dental Association South Australian branch, has stated that, quote, dental fluorosis is a window to the bones, unquote. Can you elaborate, please?
Well, not speaking as a dentist on dental fluorosis, but as a naturopath, seeing the effects on bones from fluoride exposure is definitely there in clinical practice with, not talking about so much about fluoridated water, but with exposure to fluoride in industry. So adults exposed to fluoride will get osteophytes or bony protrusion or spikes growing from that fluoride exposure. Families living downwind of industrial exposure will show often that's those same bony changes, which are just recognised as one of the signs of fluoride exposure. So dental fluorosis is caused when the child is very young and the teeth are forming, where the intake of fluoride gets active with the formation of tooth enamel, and it leaves a reduced quality of tooth enamel in that the enamel gets porous, and it then soaks up the kind of the colourings in food, tea, tobacco, and then starts to go from often a white marking through to a darker marking, though everybody's very different. So it's a window in the teeth because you can see the changes there. You cannot open up somebody's leg and have a look at the tibia and fibula to see what the markings are in the bone in the leg. So it's one of the only windows that are there to observe with the fluorosis and in the teeth, and that is really important for early exposure.
Right, and I just want to elaborate there. Why drink fluoridated water, if teeth are already formed? In other words, really fluoridated water is aimed at the young or supposedly the financially disadvantaged. Now, if the teeth have already formed and erupted, can drinking fluoride, which is, you know, an internal working right through the whole system, is that going to affect people that have already got their teeth? For instance, the aged who might not even have their teeth. Or, you know, the point is that fluoridated water seems to be to prevent tooth decay. Does it have any effect on the very old or those that have already had their teeth formed and shaped?
It's a complex sort of subject as to whether fluoride has an effect on the older or elder people. There's only one definite answer there. Once somebody's lost their teeth, then it definitely won't have any effect on their dental health. But the theory is a little bit like that fluoridated water will still have an effect even though the teeth aren't forming anymore, as the theory went, it would strengthen the teeth when you're young. The theory is that the exposure to fluoride forms it changes the enamel structure. So the calcium sort of appetite in the teeth gets the fluoride, a very reactive molecule, getting in to form the fluoroapatite, which is meant to be harder and less resistant to decay. So there is still an argument there that may be kind of something the dental authorities might pursue, but the actual lack of any real difference in the tooth decay rates between fluoridated and unfluoridated cities is making it a bit untenable to say it's of much effect. And as Dr. Andrew Harms, you mentioned, has pointed out at seminars I've gone to, where he's pointed out that yes, there is some hardening of the enamel, but that is at the destruction of the inner tooth. He talks about the fluoride bonds that are produced by a hardened enamel that cracks, and infection gets inside the tooth, and the tooth just more or less explodes and falls apart. So if the fluoroapatite is hardening the teeth from exposure, probably mainly to toothpaste and dental treatments, then it is possibly not having any long-term beneficial effect if there are pathological changes taking place as a result of the changes in that tooth enamel structure.